Almost 1/4 of American women are unable to get pregnant just after 1 year of trying. Not only that, it's actually getting worse. Women are becoming more infertile, and almost all other forms of menstrual dysfunction are on the rise. With everything we know about modern medicine, why are women getting sicker? Hi, my name's Amy Leisha, and I'm obsessed with health, and especially women's health. I've dug into a lot of research, and the data is face melting. In this video, I'm going to talk about the alarming statistics of women's health issues, the current medical system's insane approach, why the pill is a misleading scam, and finally some positive research-based solutions so you don't have to leave this video completely depressed. Now let's dive deeper into those face-melting statistics. The pain and suffering from menstrual dysfunction. Menstrual irregularities and disorders are on the rise. There are many different forms, but let's take a look at a few of the main ones, starting with pain. Period pain, or dysmenorrhea, is the most common gynecological disorder in young women and affects just under 3/4 of young women worldwide. That's just under 75%. That is majority of young women. Research from 2019 has found that period pain can have a negative impact on everyday tasks and experiences, including education. Even when individuals can tolerate menstrual pain and attend school, they report that they underperform as a result of poor concentration. So the pain is stopping normal everyday function, which is not ideal. It's typically associated with cramping, nausea, vomiting, sleeplessness, depression, headaches, and other conditions. They're just a few. They are all really nasty things to deal with, especially every month. Period pain affecting daily function isn't normal. I grew up believing it's normal because it's so common. It is often brushed off, and we're told to deal with it. Just because something is common doesn't mean it is normal. It clearly has a significant impact on daily function and life for so many, and that is not okay. Let's take a look at endometriosis. Endo affects roughly 10%. That's 190 million of reproductive age women and girls globally. That's a lot of people. It is the second most common gynecological condition in the UK. And endo is weirdly mysterious as there are so many unknowns about it, and its diagnostic criteria varies wildly. So we don't know what the true number of endo cases are or whether it's actually increasing or not. This is ultra problematic when we know so little about a disease that can be debilitating, affects so many women worldwide, and has no known treatment to date. Biologically, it is pretty much extra uterine tissue that grows outside the uterus where it should be. This can cause severe life-impacting pain and infertility, just to name a couple of symptoms that people get from endo. For many, this is life-altering, and yet another issue severely affecting women, widely going undermanaged. Next, let's take a look at polycystic ovarian syndrome, or PCOS. It affects an estimated of 8 to 13% of reproductive age women worldwide. That's even higher than endo, and up to 70% of affected women remain undiagnosed. That's probably at least 1/3 of women worldwide. So a lot of people have no idea that they have these issues. Researchers found that PCOS has actually increased by nearly 65% over the past decade. 65%! That is an insane percentage. Despite us worshipping at the altar of modern medicine, something is broken and women are getting sicker. And we also found that women with PCOS had more severe observable traits overall than a decade ago. So not only is it increasing, but the severity is also getting worse. So what is it? It's basically a condition that affects the ovaries and can cause women to not ovulate. And ovulation is the star of the show for a women's cycle. So without it, you don't actually truly have a proper cycle. Ovulation is so important. I've also heard PCOS being referred to as the diabetes for women, as it's an imbalance of hormones and insulin resistance. It can cause painful cysts, irregular periods, weight gain, and so many more symptoms. They are, again, just a few. But it is also the leading cause of infertility. The rate at which PCOS is increasing is alarming, especially considering its significant negative effects on women. Speaking of infertility, in the last 70 years, fertility rates have dropped more than half. So fertility plummeting and infertility is increasing, affecting 17.5% of the adult population globally. That is 1 in 6 people, men and women. So worldwide, 1 in 6 people are diagnosed with infertility. They can't have children diagnostically. So to put this in perspective, based on those numbers, if you have 5 friends, 1 of you will likely be diagnosed with infertility. Let that nasty reality sink in. That stat is men and women, so let's just take a look at women. 19% of American women of childbearing age are unable to get pregnant after 1 year of trying. 19% is 1 in 5. So you have 1 in 6 men and women, but you have 1 in 5 just women alone, and infertility rates have been on the rise for the last 30 years. This is with modern medicine in arguably the most technologically advanced Western country in the world. With everything we know, why are women becoming more infertile? Sickness always has a cause, whether we have discovered it or not. And in this case, I believe the cause is likely a varying degree of menstrual dysfunction. It's not infertility because the body just decides, I don't want to be fertile. That's not our design, and it just doesn't make sense. All of this is painful and devastating for so many. The female body is designed to be healthy, pain-free, and to bear children. It doesn't make sense as to why in a medically advanced society, we would have such rising rates of disease and infertility. Menstrual dysfunction isn't normal. Infertility isn't normal just because it's so common. Sickness and pain shouldn't be normal. This is why medicine exists. So what's the medical system doing about it? Let's take a look at the current medical system's insane approach. Picture this. You fall over and you break your leg. You go to the doctor to fix it and they tell you, you'll be okay. People break their legs all the time. And their solution is they give you a helmet because you wouldn't want to get a concussion if it happens again. Think about that for a second. You break your leg, they give you a helmet because concussions are bad. This is happening to countless women daily. I had a lot of health issues a few years back, including pain and abnormalities with my menstrual cycle. I went to see a doctor for help and was handed the pill because not falling pregnant was supposedly going to fix my problems. My option, if I didn't want the pill, was to educate myself and find an alternative solution. That was the only option the doctor gave me. I didn't feel overly cared for, and the solution just really didn't make sense to me. Why provide a pregnancy prevention drug for menstrual abnormalities? Why are we not trying to find out why I had menstrual irregularities to start with? Now let's fast forward to the next unusual interaction with a doctor. When my husband and I decided we were ready to try and fall pregnant. I'm all for preventative health, and in the months and years in the lead up to trying, we were both very health conscious, and I worked hard on getting as healthy as I could and worked hard at normalizing my cycle. At the point of trying, I had concerns about my hormonal levels and the ability to conceive as my periods were getting shorter and shorter. I was very lean and I wanted to check where things were at to optimize my health and reduce any potential pain and heartache down the track. I thought being proactive was good. I shared my concerns with the doctor, who told me it's not worth checking your hormones and they were only to investigate if we were unsuccessful at getting pregnant for 12 months minimum. My jaw dropped. She proceeded to say they would then do a basic hormone assessment, check sperm count, and if still concerned, they would refer me to a fertility specialist for IVF treatments if I wanted. This just honestly was kind of baffling. Again, I didn't understand why there was no option to try and work out why, let alone take a preventative approach. Fast forward to another doctor when I actually did fall pregnant this time. I again wanted some basic bloods done to check my hormone levels to make sure all was well. I was concerned about my progesterone levels. She laughed at me and said, relax, I'm not to check anything until a woman miscarries 3 times. Until a woman miscarries 3 times. Just the thought of that is absolutely devastating. For any woman who has experienced that, I don't know why I was surprised with the given history, but I could not believe that that was the protocol. I understand testing is not always indicated and isn't always going to do much. However, when sickness, disease, and infertility is on the rapid rise, I would expect some kind of urgent care and attention to menstrual health and fertility, at the least. Maybe a little bit more care. These doctors were just following protocol. It was not their individual decision, it's the system in total. Let's take a quick look at the current medical system's protocol. To start, the Mayo Clinic's current recommended treatment for PCOS. This seems to be the general treatment plan across the board. First off, lifestyle changes. Thank goodness this is mentioned. However, it's really only mentioning it for weight loss and is suggesting a low-calorie diet. I have issues with this because a lot of people with hormone dysfunction have difficulty with weight loss, and a low-calorie diet doesn't always work. It can cause more stress, let alone the research showing it's not an effective long-term solution, with a large percentage of people putting the weight back on in 1 to 5 years. There's a lot better ways to look at weight loss. I've made a video on it, but I mean, I guess at least they're mentioning it. The next treatment option listed is medication, starting with birth control pills, as they suggest they decrease androgen production and regulate estrogen, which is what you want for PCOS, I guess. They state that regulating your hormones can lower your risk of endometrial cancer and correct irregular bleeding, excess hair growth, and acne. And yes, regulating hormones can do that, but the synthetic hormones in the pill will just symptom manage by masking the real issue of why the hormones are imbalanced. The pill has increased cancer risk itself and does not create a solution for anyone wanting to have children one day. Let's not forget that the pill in its design is a pregnancy prevention drug. I will deep dive into the pill shortly. The next thing they list is progestin therapy, often given as a first step in infertility treatment for PCOS. PCOS. According to a study by the National Institute of Health Research Network, progestin appears to decrease the odds of conception and of giving birth. It decreases your odds of having a baby. Why is it used for fertility? Those who didn't take it were 4 times more likely to conceive. What? So that kind of baffles me. I don't understand why they're using it for infertility. They then list off a plethora of drugs available for all the different symptoms someone may want to treat, all with their own risks associated. None of these actually fix the root cause of the problem. They only mask it. None encourage the body to regulate its own hormones to restore homeostasis. The Royal Australian Council for General Practitioners has published some basic guidelines also when it comes to PCOS. Given I'm currently in Australia and that's where I had most of my interactions with the doctors here, they again have a relatively similar treatment online as the Mayo Clinic. Lifestyle changes, specifically weight loss, oral contraceptive pills, cyclic progestins, metformin, pharmaceutical drug treatments, and IVF for infertility. While it is excellent that they are even looking into this and have some kind of a plan, it is very focused on masking symptoms rather than healing the actual problem. There could be plenty more detail given based on the extremely promising diet and lifestyle research that I will soon talk about. There is such a heavy focus on pharmacological treatment. Only issue is that doesn't restore the underlying dysfunction and may have its own risk factors or symptoms in itself. When looking at dysmenorrhea or period pain treatment protocols, we see a similar story. Anti-inflammatory drugs, hormonal therapies, basically the pill, and other drugs. Drugs. They do have a listing of non-drug interventions, basically alternative options and diet and lifestyle. And they've listed the evidence available for these treatments. Granted, it's limited, but the fact that they even list it, I think is absolutely huge. Even if it's the last possible thing that they list at the bottom of their website. Something like endometriosis is trickier as there is no known cure and treatment options are limited. So it's all based on symptom management. Contraceptives, all sorts of pain relievers and surgery is the current go-to. Many people with endometriosis see their doctor for regular surgeries just to manage the symptoms. There needs to be another solution. None of these treatments address the corresponding infertility, and a lot of the treatment options that they have to manage the pain often leave women having to choose between pain and fertility. Both the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists report that menstruation should be monitored as a vital sign in adolescent girls. Your menstrual cycle is a vital sign, just like your heart rate, body temperature, respiratory rate, and blood pressure. Yet we don't treat it like one. This system is an ambulance at the bottom of a cliff. Why don't we just put a fence at the top of the cliff? Great question. I think one of the reasons is because the ambulance makes more money. This approach has left many women sick, hurting, discouraged, in pain, at a loss, with illnesses they may even not know about until years later, and ultimately 1 in 6 with fertility issues down the track, potentially when it's too late. Just because the cause of many of these issues is unknown and there is no quick, easy fix, symptom managing, regardless of the cost, has become the norm. And the introduction of the pill seems to be the lazy symptom masking solution, despite the complications and consequences it brings itself. Which brings me to the pill is a misleading scam. Let me explain why. This is important because, as mentioned, it has a huge impact on the medical system's approach to treatment. The introduction of hormonal birth control in 1960 brought newfound freedom for women when it came to pregnancy prevention. However, it also brought a number of consequences that I don't believe were assessed or taken seriously. One being the overprescription for it for things that are not pregnancy prevention. Hormonal birth control are any birth control options that are infused with synthetic versions of your sex hormones, which cause varying degrees of endocrine disruption. So basically, estrogen and progesterone with their aim to stop ovulation and your natural cycle. Let me say that again, to stop ovulation and mess up your natural cycle. That's their design. On a molecular level, the hormones are completely different from the estrogen and progesterone your body naturally produces. The pill does not regulate the menstrual cycle. It just appears that way. It stops the natural function using synthetic hormones. When it was first created, women thought they were pregnant when on the pill because they didn't get a period. So a fake bleed was added to make women think they had a regular cycle or period and that it was not completely messing with their normal cycle of their bodies. Thinking that you can stop or suppress your cycle with hormonal birth control without consequences is a lie. There is risk associated with it that is often downplayed. If you've ever been on the pill, you will hopefully know that you have an increased risk of deep vein thrombosis, clots, and stroke when taking it. And the doctor always mentions it's minimal and probably fine. So many people take it with not these issues. It's a tiny percentage. So you don't think twice about taking it. You trust the doctor. However, what they fail to mention is all the other risks associated, including some of the following. They increase the risk of anxiety, depression, lower libido, and and cause hormonal imbalance. Let's take a minute to think about that. Laboratory neuroscience studies have shown estrogen and progesterone in the pill greatly influence neurochemistry and brain function. They literally change your brain. This can cause depression, behavioral changes, and disturbances in cognition. I don't know about you, but some of you may be able to relate. When I was on the pill, I felt like I was going crazy. Moving on to something equally as mind-blowing, they can cause nutrient deficiencies by disrupting nutrient absorption. It has been shown that the key nutrient depletions from hormonal birth control include folic acid, vitamin B2, B6, B12, vitamin C, E, and the minerals magnesium, selenium, and zinc. That's so many nutrients that are being depleted. If you haven't been told that and then you're not supplementing that to try and fix it, people are just going to end up with malnutrition. Everyone raise your hand if you were told you'd probably have nutrient deficiencies if you went on the pill. I haven't really heard anyone ever talk about it. And get this, it can also shrink the clitoris, vulva, and ovaries after just 3 months of taking it. It's physiologically changing the structure of your anatomy. What? Definitely not ideal. Get ready for this one. Long-term hormonal birth control use increases the risk of breast, cervical, and liver cancer. Cancer is nasty and should be taken seriously. This is not just a little, oh, you might have a cold or a rash. According to the research, I'm not overly surprised, as the pill is purposely designed to shift your natural hormone levels to prevent ovulation. And from previous research, I haven't mentioned in this video, but have in another one, we know that an imbalance of even natural hormones increases risk of cancer. It can also take up to 12 months for your natural cycle to return when coming off hormonal birth control. So it should be factored in when trying to conceive. The pill was the first drug ever developed to shut down a perfectly normal and healthy process in the body. So why do doctors overprescribe contraception, a pregnancy prevention drug, as a treatment for menstrual cycle abnormalities? It really doesn't make sense. It creates a fake cycle and only masks the true problem, leaving women potentially worse off than when they walked in, especially if they're not informed. It is twice as concerning knowing all the potential risks associated with the pill. I don't think hormonal contraceptives are the enemy. I think the way that they're commonly being used without proper education and information is the problem. I certainly wasn't told any of this when a doctor tried to put me on the pill, not for contraception. I don't know that I would have chosen to take it if I knew what I know now. This is doing women a great disservice. Not only is education around menstrual health limited and lacking, the support and treatment options prescribed to women are less than adequate, leaving women unaware of what's truly going on with their bodies and potentially affecting their fertility later in life. The medical system has a responsibility to give the best patient care to people. I don't think uninformed symptom masking is best patient care. Because we need some positivity, let's take a look at some of the promising research into treatment options. There are many treatment options that are research-based, and there are countless anecdotal experiences of treatment options healing people's symptoms of PCOS, endometriosis, dysmenorrhea, amenorrhea, and irregular periods and infertility issues. Diet and lifestyle being the main very effective treatment. There is no quick fix pill, as much as the pill is pushed as the too good to be true option. Let me quickly run through some of the research on this. Okay, PCOS. A 2017 systematic review of clinical trials found that low-carb diets tend to reduce circulating insulin levels, improve hormonal imbalances, and resume ovulation to improve pregnancy rates. A 2019 meta-analysis showed similar findings, concluding proper control of carbohydrate intake provides beneficial effects on some aspects of PCOS and may represent one of the important interventions improving the clinical symptoms of affected patients. So yet again, managing carbohydrate intake or reducing carbohydrates is effective. Another systematic review concluded that low carb is likely superior for fertility and restoring normal menstruation. So basically, a low carb diet or ketogenic diet has been shown again and again to have positive effects on PCOS, menstrual cycle regulation, and fertility. Endometriosis has similar findings with low carb diets and anti-inflammatory diets. Also, 12 years of data collected in a nurse health study found that people who consumed more omega-3 fatty acids appeared to be 22% less likely to receive an endometriosis diagnosis. Meanwhile, those who had the highest trans fat intake were 44% more likely to receive the diagnosis. Omega-3 fatty acids, less likely to have endometriosis. Crappy processed high trans fat diet, significantly more likely to have a diagnosis of endometriosis. Diet and nutrition, nutrient and anti-nutrient intake can have a large effect on these menstrual cycle disorders. There is plenty more research available. However, we'll be here all day if I continue to go on. I believe women should know about these options and have the option to explore. And if then they choose or want to mask the symptoms with hormonal contraception contraceptives or other medical interventions, that's okay, as long as the woman is adequately informed of the options and the consequences. It's her choice, but it's her informed choice. Diet and lifestyle changes are certainly not easy. They do take time and require support. It is so much harder when trying to go at it alone. So what if the medical system had a diet and lifestyle treatment protocol that provided checkups and testing to assess changes, having support and reassurance along the way, where you felt like you were adequately supported? I don't believe no one is suggesting these things because it is well researched, but what if the doctors in the medical system were the biggest advocates for helping women heal their issues and spend time preserving fertility early on, rather than addressing it after people are in the thick of pain and heartache 12 months into infertility? Could this turn around some of the menstrual cycle dysfunction and infertility and see the statistics move in a more positive direction? It would be great to see the system shift. So what would that look like? First of all, no more shame. Let's normalize having periods, talking about periods and the menstrual cycle in whole. As a woman, for most of my life, I felt disgusting that I bled every month. This is not okay. Let's start acting like it's normal because it's normal. Secondly, parents, teachers, and doctors, and anyone responsible for education need to start talking and teaching about this sooner, more in depth and more frequently. It's coming too late and it's not practical or helpful when it does. And lastly, the medical system just needs to step up. Stop overprescribing drugs to mask symptoms just because it's the most profitable option or the easiest option. I do believe that individual medical staff genuinely care about the patient and really want to help change lives, but many of the current incentives have led to a broken system that isn't interested in the root cause, leaving a lot of people lost and hopeless. But a healthy person just doesn't make a good customer. We need to address the menstrual cycle as a fifth vital sign, as recommended by the American Gynecology Association. Have it checked on and asked about every doctor visit. If there are irregularities, they should be addressed and investigated to provide adequate treatment. With this, I believe we would see an increase in women's health empowerment and a decrease in menstrual health issues and infertility. But until then, what we can do is educate ourselves and others. If you like this video, subscribe and check out this video right here where I talk about how schools failed women and I go into the education side of all of this. It is just as fascinating, if not more. It is the second piece of this kind of overarching puzzle. And check out some of the other videos on my channel because I do a lot of evidence-based stuff. Otherwise, click on this video and see you in the next one.